Ketamine is the shit. It is so much fun. I'm kidding, kind of. But in all seriousness, it is a good drug to use for many indications. It is a sedative hypnotic agent that will leave your patient feeling like their mom is holding them when they were a baby. They will see beautiful colors, geometric shapes, hear colors, and smell sounds. But besides feeling absolutely great, ketamine is a versatile drug. It provides sedation and analgesia all in one. It helps to preserve the blood pressure. It is a potent bronchodilator, so it's great to use in an asthmatic patient that needs sedation. With the pain management thing, I will note that yes, ketamine in of itself works fantastic for pain, but not at the dose that many EMS agencies have as their pain dose protocol. To achieve good analgesia in that patient who has their foot completely turned around, or in the patient with an L-shaped femur, 0.25 or 0.3 milligrams per kilogram of ketamine isn't really going to do the trick. You have to either give them a sedation dose or you have to use that ketamine in conjunction with another pain medication. In my opinion, optimally fentanyl. One of the great things about ketamine is that it doesn't drop the blood pressure or cause respiratory depression like opiates or benzos will. Ketamine stimulates the body to release stored catecholamines that will increase the heart rate and blood pressure. That's why it's a great drug to use in a shocky patient who needs airway management, sedation, or analgesia. That being said, if the patient is in a high degree of shock, they have depleted their catecholamines, and just like a seminal vesicle that emptied 45 seconds ago, you can stimulate all you want, but nothing's going to get released. So you give them a dose of ketamine and make their pain go away, you're actually blunting the sympathetic response, which is keeping their blood pressure up, and when you blunt that, the blood pressure tanks and the patient crashes. Ketamine also preserves the respiratory drive. It's great to use for sedation or for the combative patient who you want to send to a different dimension of altered mental status, but you want them to keep breathing and have an airway intact. Ketamine must be given slowly. If you're giving it IV push, it damn well better be a slow IV push, because if you slam ketamine, you're going to lose all of the benefits of ketamine. Slam it, and the patient's going to drop their blood pressure, they're going to go apneic, and they very well may get laryngospasm, and for an added bonus, they might puke. Switching gears, when giving ketamine for delirium with agitated behavior, can't say excited delirium anymore, the usual dose is 4 milligrams per kilogram intramuscular. It works very well. I've given it many times for this. However, it is unpredictable with how hard it's going to hit the patient. I've seen it only work a little bit before and take the edge off a little bit, but then I've seen on a huge patient who was really out of control, it knocked them out so hard that the patient was straight up unconscious and had to be intubated. But you do what you got to do to be safe. Always monitor the patient's EKG, pulse ox, and end-tidal CO2 when giving ketamine for any reason, but especially for this delirium with agitated behavior, because all eyes are going to be on you. So what is with this stigma with ketamine? Well, one, it's because in the hospital, not a lot of people are used to using it. An ER physician friend of mine says that he often gets pushback from colleagues or from the pharmacy when he wants to use ketamine for anything other than airway management, and he said that he thinks it's strictly because people are unfamiliar with it. I did have a medical director once say that it has a high potential for abuse and for being stolen, but that sounds dumb to me because most paramedic units carry enough opiates to kill an elephant, and those don't have the potential to be abused or diverted. But the real stigma with ketamine comes because some idiot paramedics have misused it. In particular, this Colorado case where they killed an innocent autistic kid, the police perceived him to be a threat and asked the paramedics to give him some go-go juice to go to sleep, and they overdosed the young man and killed him. Yes, we give ketamine for delirium with agitated behavior, absolutely, but we give it when the delirium is causing an imminent threat to safety or a threat to the patient's life. As much as I love cops and support the police, don't ever listen to a fucking cop when it comes to how to treat your patients.